Hey guys, Mike Dirks here with another West Coast Fitness interview. Today I get the chance to interview my good friend and colleague Dr. Ryan Oughtred, and today we're talking about human growth hormone. So Ryan, tell us, what is it and what does it do to our body?
Human growth hormone is a hormone in your body that's made by the pituitary gland up in your head. It's part of your brain, basically, and it signals the liver in your body to make growth factors that stimulate growth and also promote metabolism in the body. So it's really essential for growth in children. It's essential for growth of all tissues, but especially the musculoskeletal system.
Right.
And so in kids that don't make enough of it, they end up being too short in stature. And so they use this hormone to assist with that, to assist normal growth before the end plates of the bones in kids are closed.
Right.
And then in the anti-aging world, you would use it in much smaller amounts, but use it in amounts that would help bring people back up to levels that maybe they were used to having when they were younger.
Right. So as we age, there's potential in some of us that our human growth hormone will start to, the production of it will start to decrease. Is that correct?
Yeah, it's the highest when you're young.
Right.
And then it'll slowly decrease from, I think, about the age of 20 years old. It starts to slowly decline with age.
And this can happen faster in some individuals than others, correct?
Yeah, like if you're on certain medications, if you have certain illnesses, or you're just unlucky, then it can certainly go down. Lifestyle makes a big difference. Like if I test people who are more active, they do a lot of exercise, they have good diets, they sleep more, they typically are going to have higher levels than somebody else who doesn't have those things going for them.
Now you just mentioned it, test. You can do a test, right?
You can do a test.
That test the level of human growth hormone and if you need to kind of top up those levels. So explain that a little bit.
Well, we use a 24-hour urine test, and that's because your body makes growth hormone in little spurts all throughout the day and the night.
Right.
And so to measure it in the blood is useless because it's always going up and down, up and down, up and down. So it's better to get a 24-hour picture of what's going on. So we use the urine. This isn't the test that say an endocrinologist would use. An endocrinologist would use a stimulatory test. That's really going to be looking for an inability of the pituitary gland to actually make it. So they would stimulate your pituitary to make a bunch of it, and it doesn't respond, and basically they end up being low still. Right. This is more of a test that's going to find those kind of more minute changes as well. Like if it's slowly declining with age, this test is going to pick up that. And then if the symptoms pair up, so you got to look at what people are feeling. So if they're having fatigue, they just don't have the same muscle mass that they used to. And a guy named Terry Herzog, who's a kind of a famous hormone replacement guy, he said the picture is for people who have strong levels of growth hormone, good levels, they're firm body and they have firm mind. Right. So in a way, and if you look at, if you talk, it's pretty popular with celebrities, and I like to say that one of the biggest side effects of growth hormone is that it makes you go poor. Right. So it's quite popular in the wealthy and the rich and the famous because it is expensive to do. Right. And if you do it in larger amounts, anyways, in smaller amounts, it's more reasonable. But what they'll say is that it does give them a firm mind again. It gives them that kind of youthful feeling and that focus, and that's something that people didn't really think about. They're really thinking about physical things a lot of the time when they come in, and they come back and they try the hormone and they're like, wow, I feel young. Right. Yeah. Cool. So basically, if someone's experiencing those feelings of fatigue and lethargy, and maybe the sex drive is down, that would possibly be a sign to come and get tested. Yeah, poor hydration, the skin lacks its normal kind of spring back, that they say that's also a... So at what age would that typically happen? So if people are watching this out there right now and they're thinking, well, that might be me, typically what age could that start to happen? Yeah, most anti-aging docs don't really start doing anti-aging therapies until mid-40s. Gotcha. And forward. But like I said, if you have health problems or you're taking medications that can mess with it, then you would start earlier. Right. Yeah. Great. Yeah, you never know. You could just test it, see where somebody's at. If it pairs up with their symptoms, try it. There's certainly no harm trying something short term. Yeah. If they're feeling great, then you can. If it doesn't help initially,
Right.
then what's the point anyways, right?
Yeah.
But,
Yeah.
yeah.
That's great. Thanks for the info. If you guys have any more questions regarding human growth hormone, or if you potentially want to come in and get tested, you can check out, you can contact Ryan actually by going to his website.
www.ryanouchtred.com. The last name's Oughtred, but
It'll be on the video, so you guys will get it right at the end. And the phone number?
604-806-0025.
Great. Thanks, Ryan. Keep coming back for the next video, guys. Stay tuned. Have a great day.
Thanks, Mike.